here we are at the panel, and I'm really excited to introduce our first panel. I'm so excited. It's near and dear to my heart. This is another, how I met some of these people was I went to a grant out through Barb. Thank you, Barb, again, and went out to NYU to learn about special needs dentistry. And who's going to be our moderator today is somebody I've known from the past, and this is our moderator is Sheba Jones. Sheba is an RDH, MSDH, AP, CHSE, FADHA, is a critical care dental hygienist at Chandler Regional Medical Center and dental hygiene faculty at Phoenix College. So nice to see you, Sheba.
Thank
With
you.
22 years of clinical experience, she is passionate about public health education, professional advocacy, and mentoring the next generation of highly skilled patient-centered dental hygienists. She holds a master's from Foreign School of Dental Hygiene at the University of Bridgemont and is pursuing her doctorate degree at A.T. Stills University. Congratulations. She's also the founder of Sheba RDH Smile Series launching soon. Uh, thank you, Sheba, for taking your time to be a part of this. I really, truly appreciate this.
Absolutely. Thank you so much for that wonderful introduction, Tammy. I've known Tammy for a little while. We've worked together, and I'm so honored and excited to be here today. So this is a very important panel discussion. Our focus today is on oral health equity for individuals with intellectual and developmental disabilities. So what is IDD? It's an umbrella term to describe a range of lifelong conditions characterized by impairments of physical, learning, and behavioral impairments. These individuals often face significant barriers to accessing quality oral care. And so today we'll hear from some leaders who are making a big difference in this space. So I'd like to move into introducing our three amazing panelists today. Our first panelist is Angelica Laura, and she's with Raising Special Kids. Angelica is a behavioral health administrator at Raising Special Kids. Here, she supports families navigating behavioral health system, and she advocates for inclusive, family-centered care. She's currently in her final years at Arizona State University, earning her bachelor's degree in social work. Congratulations. In addition to her professional expertise, Angelica brings a deeply personal perspective as the mother of three boys with varying disabilities, including cerebral palsy, ADHD, autism, and anxiety. Her dual role as both a parent and a professional gives her a unique insight into these challenges that families face, and it fuels her passion for system change, equity, and empowerment in the disability and behavioral health communities. Welcome, Angelica. Our second panelist is Lynn Black with Ability 360. Lynn Black is a licensed master level social worker with over 25 years of experience working with individuals with disabilities, specifically developmental disabilities. She's a program developer, manager, trainer, and system change agent in Ability 360's advocacy unit. Since 1997, Lynn continues to work with self-advocates in her civil rights, self-advocate-run organization called People First of Arizona as their state advisor. Thank you for joining us, Lynn, today. Our final panelist is Barbara Vartanian with NYU. Barbie Vartanian DuPont is an inaugural director of oral health advocacy and policy initiatives at New York University College of Dentistry. Here she champions equitable oral health care for people with disabilities, leveraging her work with NYU's Oral Health Center for People with Disabilities. She advocates for improved clinical education, accessibility, and legislative change to address oral health disparities. Her advocacy is deeply personal, inspired by her own son with autism, and she uses her own lived experiences to educate future healthcare leaders about inclusion, belonging, and the human side of care. Thank you. Welcome all. We're going to move into our questions, and I know that Tamara and other hosts have put into the chat. We just want to respect the time. If we have time at the end of this panel, we will try to address some of the questions in the chat. So our first question, you'll have about 2 minutes each panelist will. So the first question is, can you share about your organization and the biggest oral health challenges you encounter when serving the IDD population? And we'll start with Angelica.
So, Raising Special Kids is the Parent Training Information Center of Arizona. We support the entire state, and we help support and train families that have children with any kind of disabilities from 0 to 26. And there are some times that we get calls from parents that have children in their 40s or their 50s because regardless of our children's age, they are still our babies. So we're here to help with all questions, no question too small or too large. One of the coolest thing about our organization is that we help support, everyone that works here is either a family member or a parent or child with special needs. So the parent is always going to talk to someone who understands. We have been around for 45 years, and as of May 15th, we are no longer going to be called Raising Special Kids. We are going to be In Circle Families. So look out, for our new website change and all the other fun stuff that's going to come down the line. And to answer the second part of your question, I think one of the biggest challenges is that when we think about dental health and disabilities, it's like a afterthought for a lot of us as parents. We really don't think about, oh, my child getting their cleaning. Oh, I got it, the last 6 months. I'll get it again in the, next 9. But we really don't think about how the health of our child goes hand in hand with their dental health. And that's something I had to learn firsthand as a parent with my older son. I got a crash course in it. We went from having a hole in the tooth to a skin infection to a hospitalization. So that was a huge wake-up call for me as a parent. And ever since, I always have conversations with everyone that I talk to. When's the last time your kiddo went to the dentist?
Thank you, Angelica. Lynn, let's hear from you next.
Hi, everybody. Thank you very much for having me here today. As mentioned, I work for Ability 360. We also work very closely with Raising Special Kids. We are what's called a Center for Independent Living Agency. And what that really means is that we are a private nonprofit agency. We are located in Maricopa County, and we are consumer controlled, community-based, and cross-disability. And we do not do any residential. We offer programs like independent living skills, teaching advocacy skills, information and referral skills, and a lot more programs than that. Our purpose or mission is to empower others to live in independent lifestyles in their communities and where they choose to live. There are actually 5 centers for independent living in Arizona, and there are hundreds nationwide. So if ever you guys move out of state, you can look up where your center is in that state. Some of the biggest challenges that we hear about, mainly for adults who are over 21 years old, is that the Medicaid Access Program doesn't cover comprehensive dental coverage, and they only have $1,000 emergency dental benefit. And that results in having their teeth pulled and having issues with speaking and eating and all other types of challenges. Also, there are a lot of others who have a hard time communicating regarding how to make an appointment, when to make an appointment. So we notice issues regarding, even if they do have coverage, they're having issues of not understanding what that really means, where to go to get the help that they do need. Then there's also the trauma of bad past experiences that can affect challenging behaviors, which I'm sure that this conference has already probably talked about. Others with aggression or high anxiety of past procedures that have gone wrong, being afraid of the unknown, and not knowing the environment that they're going to be going into. So there's lots of challenges out there.
Thank you for highlighting that, Lynn. Barbara, would you like to address this question?
Yes, thank you. And thank you for having me. And honored to be on the panel with these lovely ladies. So yes, as part of NYU College of Dentistry, we are the largest dental school in the country. We actually graduate 10% of the providers out there, which is a tremendous opportunity to ensure that our students graduate with the confidence, the competency, but most importantly, the compassion needed to treat those with intellectual and developmental disabilities. And our students gain those skills through their exposure to our Oral Health Center for People with Disabilities, which is an 8,000 square foot interdisciplinary center that treats over 10,000 patients annually. Our students have mandatory rotations in the center starting in their D2 year, which is their second year of dental school. And then their number of hours in the center increase each year, which is fabulous and very much necessary. And then I would say, some of the biggest challenges, and some of them were already mentioned, is an untrained workforce. So up until 2019, it was not a requirement of dental schools to teach this. The only specialty that did have more comprehensive training was pediatrics. So with those changes, again, prior to that, there wasn't that experience. Also, the bias and stigma in treating our population is still there, which is unfortunate. Like was mentioned, the reimbursement rates are inadequate, especially in academic institutions and some of those safety net clinics. Behavioral challenges, transition is a huge problem. A lot of times pediatric dentistry wants to transition our kiddos out at 12 to 13 because some of our kids are much bigger, a lot of times because of the medications and things like that. So currently there's not a lot of places for them to transition to. I think for our patients, some of the biggest things we hear are transportation, coordination of care, guardianship issues, many folks not understanding what that looks like or what that process is all about. And then a big thing is diagnostic overshadowing. A lot of times we'll go to a dental appointment or a medical appointment and everyone just assumes it has to do with the autism or whatever that medical diagnosis is, when actually it could be something entirely different. So those are some of the big challenges that I see.
Thank you so much, Barbara, Lynn. And I'd like to make a pronunciation correction with our first panelist. Her name is pronounced Angelica Laura. Thank you so much for all sharing about your organizations, what they do, and the challenges that you're facing. I'd like to move on to the second question. The second question is, what innovative strategies or programs have you seen or implemented to address oral health challenges? I'd like to have about 5 minutes per question. Let's start with Barbara.
Oh, okay. We're going into order. So I'd say some of the innovative things that, we're doing in the center that I think are really, really working is the utilization of behavioral support interventions using applied behavioral analysis, which is ABA therapists, which many of us know in the community what that is. Many of us have ABA therapists that work with our kiddos, and then as well as some of the sensory adaptation interventions, such as some of the methodologies utilized in occupational therapy. So it's kind of lifting some of the things that we're already gaining in either the academic setting, like in our schools, or at the home-based environment, picking those things up and actually applying them in the dental environment. So that's some of the things that we do in the Oral Health Center for People with Disabilities. And we have just seen a tremendous reduction in the need to have to go to the OR. And that's really what we're hoping to do, is to try to treat our population chair side without some of those pharmacological interventions, because as you know, many of our kiddos have many other comorbid conditions, and adding another layer and putting them under only adds to the potential risk. So we really try to treat our population chair side. And then also something that Barb mentioned, and also Tammy, is training of the existing workforce. So we've partnered with Delta Dental, not only in Arizona, but some of the other Delta Dental affiliates across the country, and created this 2.5-day fully immersive training program where federally qualified health centers and community health centers come to us and learn all the different tips and tools and tricks so that they can successfully take some of those things back into practice, and better care for the population, really building their confidence, and things like that. And we're so proud of how it's just expanded. We've worked with a lot of dental schools at this point, and now they are becoming train the trainers, and it's just really wonderful to see the feelers and the reach of the program. And then we've just developed some other ongoing in-person and virtual training programs for providers, other dental professionals, students, and caregivers, where they could learn from experts in the field as well as the community. I think it's so important to always make sure that you're hearing from either the individuals themselves, self-advocates, or us as parents or caregivers of the population. So those are just some of the things that we're working on.
Thank you, Barbara. Thank you for highlighting how educational reform, policy advocacy, workforce training can really help close those oral health gaps, especially for our patients with intellectual disabilities. Lex, I'd like to pose that question to Angelica.
One of the things that is very helpful is using anesthesia for just routine care. There's some instances where it's a sensory issue, and the automatic thing that the individual wants to do is put their hand up, and that could not only put them at risk, but also the professional. Other thing that we're observing here in Arizona is that some dentist offices are taking families one at a time, and so they're the only one in the waiting room. They have sensory areas. And then not only do they really talk to the parent step by step as to what's going to be done for the day and what can be anticipated maybe in the next appointment, but they're also breaking it down for the patient themselves so that they can understand every single tool and everything along the way and not be afraid of, oh God, what's going to happen next? You know, who else is going to be in the room? They're more worried about the comfort of the patient rather than let's hurry up and just get this done.
Yes, that's so important. Thank you, Angelica. It's a good reminder how critical it is, our role to support the families as they navigate these complex situations within the health system. So thank you so much for empowering caregivers on how to move forward with that. I'd like to pose this question lastly to Ms. Lynn.
To add on to what Angelica mentioned, we are trying to train people to be self-advocates, to respectfully speak up and ask the questions to their dentist, to their attending care staff, to their parents or caregivers who are helping them. This population has a long history of being told basically to comply and just do what you're told. So having a person learn that it's okay to speak up or say no, or this hurts, or if there's an issue that is going on is extremely important in all aspects of life. Other areas where we have seen are the mobile dental units. Having them come to the person. Again, with this population, transportation is usually a huge issue. So having the care unit, the mobile unit, actually go into group homes or day programs is very helpful, especially in like the rural areas. Other programs, which I am sure were already mentioned, were like AT Stills. I can't speak highly enough. I mean, they're just so awesome. They have the special care dental clinic there, and they actually are extremely knowledgeable and are training others, regarding the basics of how to work with others with all types of disabilities and health issues. So that is just amazing. So we're very happy about that. I would say other things in terms of just having like pre-appointments, maybe, to get to know you, ahead of time, hearing about their medical needs and their abilities of what they can do and what to kind of expect. Knowing if they want to stay in their own wheelchair or not. There are a lot of others who would prefer not to be transferred because they have in the past and have gotten hurt, regarding that, or their $1,000 of wheelchair equipment has been damaged. What I've also heard, which is very helpful, is the tell, show, do method, where you are telling the person ahead of time of what it is that you're going to be doing, and then you actually show them the actual tools, let them touch it, let them hear the sounds, because we all know how lovely those sounds are inside a dentist's office, because a lot of people get startled very easily. Explaining how it works, having them actually hold it in their hand, it really helps them build that trust with you that you're not going to spring on or scare them in any manner. We've already talked about the calming environments, which is very helpful for everybody, actually, Another point I've noticed too is like the aftercare instructions, making sure that people are actually talking to the person, not only to their caregiver or parent, but they're actually talking to the patient and explaining it to them in very easy, plain language, and actually having the handout either with pictures or in plain language also, so that they can really understand what's expected of them.
Thank you so much, Lynn. It's really important that we are collaborative with our patients, no matter what their background are. So thank you for giving us strategies on how to be more inclusive and supporting our patients with navigating, their experiences. I'd like to move on to the last question. So the last question for all panelists is, what role can dental professionals, caregivers, and communities play in improving oral health outcomes for individuals with IDD? Let's start with Angelica.
So it's already been said, but I don't think it can be said enough. Definitely follow how the parent is, interacting. If they are directing you to go ahead and talk directly to the client, of course, there's certain care that may have to be discussed after a particular maybe surgical or whatever the appointment was for. They can receive all that information, but definitely talk to the client and find out what's important to them, because you may find that there's a particular fear that maybe the parent forgot to bring up, or the guardian, or you very well may find out that the parent does not have guardianship. Mm-hmm. And so you should be talking to the patient anyways. Another thoughtful thing that I did forget to bring up in the beginning, so please forgive me, we do have a program called Parent to Parent. And that is when a parent would like to speak to another parent that has a child with the same or similar diagnosis. And this would be very helpful to any parent that maybe wants to speak to another parent that has an adult child, that's helping them navigate. Maybe they have power of attorney, or they're supporting their child without any kind of legal documentation involved. And so trying to figure out, where do I fit in all of this? How can I support my child to find their voice? And so, yeah.
I love that. Those are great initiatives. Thank you, Angelica. Same question for you, Ms. Lynn.
A lot of it has already been mentioned, as said already. What I find that is very helpful is educating the people who are actually going to be working with the patient. So the caregivers, the parents, the guardians, having them actually understand the importance of oral health and how it intertwines with the medical health. The medications that they are using, having more education on the proper techniques of how to brush others' teeth. There are a lot of others who are adults who live on their own and have attending care that come into their home. And what I often hear is that they spend like a half a minute or so brushing their teeth and they check the box. They're not understanding the actual importance of spending the time, to brush their teeth, properly. Um, I would say also it would be great if we had a national buy-in dental program. I'm aiming high here, um, that we could have, that others could understand that what that actually means. A lot of times programs come into effect, but they're not explained in easy, plain language terminology about options to buy into a program, and others get very worried about their benefits, and they're worried that they would be cut off of Medicaid or access. So I think that would be awesome if we could get a national buy-in program going on. I did hear that there are already mandates regarding requiring best practice techniques to be taught inside the schools. So that I'm very happy to hear about that. I don't know if there's anything regarding the mandating of all state and federally funded programs to include ongoing dental public health education. To others who are who are adults over the age of 21, having them learn still, or reminding them, regarding the brushing of the teeth and the education of oral health and how it impacts your life. Going into the day programs, the group home, the nursing homes regarding adults, to really do an interactive with other healthcare providers who come in contact with them, OT, PT, speech, nursing. So there's lots of interactive professionals out there that work, together. And a lot of times they have an annual team meeting. So making that a requirement that they must talk about this, at least once a year, and make sure that others are understanding the importance of it. So those are a few ideas I had tossing around.
Thank you, Lynn. You really highlighted some important things as dental professionals. So in order to kind of build that trust with the communities we serve, it's really good to educate ourselves about their needs and what they need so that we can really serve their needs the best, not just as a group, because, everyone's not in a silo, but also individuals. And that involves asking questions, finding out what their needs and wants are so that we can customize our care for them. So thank you, Lynn. I had the same question for Miss Barbara.
Yes. Okay. So I would say on the provider side, continued education, seek it. It's out there. There's so many wonderful organizations and schools that have great content where you can get CE and really build your skill set in caring for this population. I would also say gain exposure, volunteer at various disability organizations, volunteer at a Special Olympics event. The more you, again, you expose yourself to the population. I think oftentimes with providers, they have this idea of what an IDD patient's going to look like when they get into their chair. They're always fearful that they're going to be very combative, very aggressive, but only I think the statistic is maybe 5 to 10% are your more, severely impacted individuals with either autism or IDD. Most can be treated in the chair. So I think the more that you familiarize yourself and you work with the community, you gain these incremental wins, which will just in essence, increase your confidence. Always say yes before no, try. We as parents, we're so used to being told no, we can't treat your child, your loved one. Gosh, if you just say you'll try, like, oh my gosh, that'll just go so far. And we so appreciate that. And also, the other thing is too, is, as you're getting to know your patient and working with the families, if the child needs to bring their occupational therapist with them or their ABA therapist or their speech pathologist with them, encourage them to do that. The more folks you have that can help you get that successful visit, why wouldn't you want to incorporate into that into the appointment? and even working with teachers. So if something's working in the classroom, integrate that into the dental environment. My son wears a little red wristband, so he attends to class, his classroom requirements. And then when he takes it off, he's allowed to move around and get a little bit of a break. Use that same methodology in a dental clinic. It's so simple, but we tend to stay in our own little silo and not try and pull in those other support people that could really help you gain some great incremental wins in treating somebody in a dental chair. And then I think the role of the parent, we kind of talked about it already, but work with your providers. You are their best ally. No one knows your child, your loved one, the community better than you. They need you there and they value what you have to say. And then I would also say, if you don't like what you're hearing or you're seeing, say something. Don't be afraid to push back. Remind your providers that it isn't always the diagnosis that's causing the pain. There could be other things that are going on. And then lastly, I would say for the provider, the parent, and the community, advocate for legislation that supports the IDD population. So there's that bill before Congress. It's been out for a while. It's about to be reintroduced actually on Monday. It's called the Heads Up legislation that would declare individuals with IDD as a medically underserved population. It's a bipartisan bill. The two main sponsors are Congressman Moulton from Massachusetts and Congressman Fitzpatrick from Pennsylvania. Some of the highlights in the bill that would help the profession are loan forgiveness for those providers that want to care for the community, training for the existing workforce, enhance reimbursement rates for those treating the population, and then dollars for research. So it would be fabulous if we could get this across the finish line. So I encourage you all as listeners out there and parents, I would work with your local congressmen and women and talk to them about the legislation. Most of them do not know that the IDD population doesn't already have the designation. Most are very surprised. So it's very much so about awareness, and we need everybody on board to help us get this passed because there's a lot of great benefits for our population if it does.
Thank you, Barbara. It really does take a village, right?
Yes.
There's so many great resources, and you're all three of you are doing amazing things to serve this community. So thank you so much for sharing your passion, your experiences, your deep commitment to improving access to oral health and closing those gaps. Thank you all so much. So we do have about 10 minutes left. And so I see that Lynn put in the chat her contact information, and so did Angelica. Barbara, if you wouldn't mind entering your contact details for anyone that would like to reach out and get involved. Just getting engaged and involved is like the best way to learn how to serve this vulnerable community best, I believe. So I'd like to open up the chat for any questions. We have about 10 minutes. Just look back and see if there's any previous ones. Any questions?
I'd like to say something, if that's okay with anybody out there. I just a story real quick. I had a couple of children yesterday. One was their autism wasn't too severe, and then the other child was pretty severe, nonverbal. And what I learned and the ability to pass it on to some of these parents is really, and these children is really great. I mean, this child didn't want me to open his mouth at all, and I just kept working with him and talking with him. And when I was finished, it choked me up a little bit because the mom goes, "Thank you for treating them with the respect that they, and be nice to them and just doing whatever." And I said, "Look, we'll just do baby steps with your child. And as a provider, that's what you need to do. You need to just take that opportunity to try something. Hey, let's just look at my mirror, or let's just try the easiest part." And I know ever since I've gone to the training in my FQHC, I have started to see a lot more IDD patients, and I love it. I just feel like if we can do it without sedation and we could do as much we can, it's like the best we can for them, So I'd highly recommend trying to get some of the training for any providers that are on this call.
Thank you, Tammy. I do have a question in the chat from Allison. Is Delta Dental Foundation going to continue to support providers going to that NYU training? Barbara.
Well, I hope so. I don't know if Barb's still on. I keep asking her when our next group is coming. So obviously we all know it. Funding is a huge piece of all of this. So we have open arms to everyone. We actually have a team coming this Monday from Ohio. So I'd love to have more folks. So yes. Oh gosh, she said yes. We're working on getting a full cohort. So that's fabulous.
Oh, okay.
Yay.
That is great.
Yeah. And then somebody, I think, I missed her name, wanted me to mention she's the state rep. I'm sure many of you are familiar with the Open Network, which is the Oral Health Progress and Equity Network that's funded through CareQuest. They're actually doing their Hill Day, which is they start on next Tuesday and Wednesday of next week, and they will be down there. And one of the pieces of legislation that they'll be advocating for is Heads Up. And we have train the team on how to speak to it, some of the changes from the last round of administration to this bill. So yes, we're super, super excited that they've picked up Heads Up as something that they're going to be driving this year. And if anyone has any questions about it, how to advocate for it, I spend a lot of my time on Heads Up. I'm in DC a lot working on this, so please reach out and I'm happy to help you with talking points and give you whatever you need.
Thank you. We do have another question in the chat. For any of the panelists, do you collaborate with ASAN?
Hi, this is Lynn. Yes, we send out information that they provide, with us to our network of people that are interested in the empowerment listserv that talks about all legislative events or any conferences coming up or any issues that affect any person with any type of disabilities. So yeah.
Yeah, same. We just utilize them as a resource. Yeah.
Yes, as far as I know.
Oh, I know. I'm sorry. I'm going to give one more plug. So I think a lot of you know this, and Tamara knows. In 1 month, the AADMD annual conference, the American Academy of Developmental Medicine and Dentistry annual conference, which is fabulous, is going to be in Phoenix. It's the first weekend in June. I think it's like the 5th, 6th, and 7th. Tammy, right? Such an incredible conference. I encourage all of you to go when you can. We have such great keynotes and it's very interdisciplinary, and it's medical, it's dental, it's gastrointestinal, it's OT, it's PT, it's speech. It's just such a wonderful group of people coming together for the betterment of the population. So it's the American Academy of Developmental Medicine and Dentistry, and it's in 1 month.
Thank you, Barbara.
Yes. Oh, great. Barb's going to be talking. Sorry, Barb.
Go ahead. Did you have something else to add, Barbara?
No, I was just reading Barb's comment. So
okay, yes, ASAN, Autistic Self-Advocacy Network, and so she said they'll be making a big announcement at the conference. Can you guys link the conference center in the chat?
Yeah, I can put it in there.
Okay. Thank you. I'd love to welcome any other questions at this time. We have about 5 minutes.
I was just going to share a brief story, if I may, because what Tamara had brought up just reminded me. So my youngest son, who he has autism, ADHD, and anxiety, he was a late diagnosis of autism. We didn't know he had autism until he was 9. And so he would go to the dentist just like his brothers. There, everybody was very, gentle because of my older son's sensory needs. And my son, too, he had some sensory. Well, there was a bit of a tooth that was ready to come out, and the dentist goes, well, I think we can go ahead and just wiggle it out. I was like, okay, great. Well, he was wiggling it like that, and my son swung on him. And we were like, okay, so we're going to have to approach different measures, because apparently the measures that we use for his brothers are not going to work on him as well. And so that had taught me as a parent, like, okay, we need to put some other supports in place prior to even coming to the doctor, because now with this interaction, he may have a bad taste in his mouth with the dentist, but thankfully it wasn't too awful.
Do you think, this is for any of the panelists too, do you think there is not only a gap with access to oral health care needs, but like Angelica has said, her son was a late diagnosis. Do you think that there are many of our patients out there who are not yet diagnosed and what could be our role in facilitating an exploration, maybe with the family.
If you should decide to have that conversation, I encourage you to have it very gingerly because you may be exposing some concerns that the parent may be having that they're not ready to verbally express. And so, and again, depending on the relationship you have with that parent, it may be, you know what, I've been considering, I've been seeing some things, I kind of want to look into it, but I'm concerned. Or it may be, the response may be a little bit more aggressive and abrupt of like, how dare you consider, telling me that something's wrong with my child. And so I think the parent that already has those wondering questions may be very grateful that you have already brought maybe the concerns that they've been keeping in the back of their mind to the forefront. And they may want to seek that evaluation more so.
Right. So that really depends on, your relationship with the patient and their parents at that time, how to approach it. So thank you for that, Angelica. I would like to tell you all thank you. We're so grateful for your voices. This was an excellent topic for discussion and much needed within our community. And I'd like to close it out unless you have anything else to add.
No, thank you for having us.
You're welcome.
Thank you for making this part of the conference. I mean, awareness is just everything for us in our community. So we appreciate you all caring for our population. So